Many thanks, Mary, for presenting. I mean, technology seems to be ready, market pressure is there. Do you have plans also to translate it into other languages or to scale up in new countries like France or Germany?
Yeah, so the challenge for any technology where we're using natural language processing in part of it is to find the right interface for different languages. So the simplest version, I think we could easily translate into other languages. And that's just a localization task, I suppose. But some of it, which is more complex in terms of finding information when you need it, that actually will take a lot of work. And actually, you know, it's a long-term vision. So if anyone here is interested to help out, I'd be delighted to hear from you.
Thank you, Marie.
Thank you.
Did you actually know that developing a cervical cancer in sub-Saharan Africa is 7 times higher compared to Europe? But how can that be? It's because of the poor application of gynecological tests in principle. And the next speaker, Margaret Nanyombi, has developed Her Health. It's a smart app tool, and what it does, she will present to you herself.
Good morning. My name is Nanyombi Margaret. I'm from Uganda. It's a Pearl of Africa. I was raised by a single mom. She worked at a post office at that time. And I used to always visit her office after school. And there I was exposed to computers and the internet. So I was determined to be an engineer when I grew up. Unfortunately, at that time in my community, subjects in STEM were not an option for women. Most of the girls were raised to take on arts and history subjects to prepare them for careers in fashion and administrative subjects. So I was determined to do something in technology. And that's when I decided to apply for a course called Information Technology at the university. So we had a chance to do go and do needs finding in our district in Mukono, in one of the rural communities. And there we learned that at least 40% of the women around the world have bacterial vaginosis. And of these 55% are asymptomatic. And you can find like 1 in 3 women actually has bacterial vaginosis, but they don't even know it exists. In Mukono district, we happened to find one Safina. She's a mother of 3 kids, and we asked her how she's able to take care of her health. She told us a basic urinalysis test is not even an option because it's an equivalent of what? A week's worth of food for her family. In many communities in sub-Saharan Africa, women stay even 6 miles away from their nearest health centers. So going to the hospital is not an option, and they only wait until their infections worsen to seek medical attention. This is because of the high cost implication and distance in accessibility to reproductive health services. Then for the girls like me in the pre-urban areas, we are shy to go and talk to male doctors about our intimate health issues, mostly because the male doctors are the dominant in the communities where we come from. Like I told you, STEM is not an option for girls. Those subjects are looked at as subjects for boys. So our team sought to create a solution for women like Safina who don't have an option to access reproductive health services at their convenience. So what she does is collect a urine sample in a clean pickup, place a hardware which picks values of her urine sample and sends them to the mobile phone application, which computes and sends them to the mobile phone application as results she can interpret. In return, the application advises her on whether to see a doctor and where to find a doctor in an area of her vicinity. So we plan to make this available at level 1 health centers. That is for the rural communities where women may not be able to afford the hardware. And then in the pre-urban areas where girls like me may be able to afford the smartphones and probably the hardware, we shall ask the doctors to recommend this so they can use it in relation with their doctors to advise them on when to go in for further testing. Then for women who may not be able to afford the hardware, we plan to partner with NGOs dealing with reproductive health services so that they can make it available at a subsidized price. And then we also plan to partner with governments like Ministry of Health to make it available in districts that are not accessible. We've so far raised $40,000, with which we've done needs finding, like in Mokono district, where we reach out to different communities and learn their challenges in accessing services, health services. We are working on a third prototype, which is targeted to a 90% accuracy, shareable and reusable, so that the women can test at their convenience in their homes. We are also working on a telemedicine platform that can allow the patients to send their results remotely. Then the doctor can advise them whether they should go in for further testing or advise which medicines to buy in their nearest pharmacies. So far, we are working with 4 gynecologists in Kampala district who are helping us test the prototype. We have piloted in 3 health centers who are testing the telemedicine platform, and I'm currently based in Chile, where we are planning to also launch the telemedicine platform and do clinical trials. We believe we are the best team to do this, especially because we believe we are the best team to do this because we are in an area where we understand the solution, the problem, more than anyone else, and no one can better create a solution other than someone who has gone through it. And with a technological background and passion to create linkages to affordable and tech solutions in low-income communities in Uganda and beyond, we ask you to join our cause to empower women around the world to take their health into their own hands. Thank you.
Thank you, Margaret.